Trecostomy tube change requires 2 persons. Identify a main caregiver who will perform the sterile procedure and an assistant. To prevent food contents from entering the airway, the patient should fast for 6 hours before tracheostomy tube change. Clarify with your medical team to check if there are medications to be omitted before the procedure. Serve painkillers if needed. Tracheostomy tube change is a sterile procedure. You need to prepare the following items: a new tracheostomy tube set, a sterile dressing set, a pair of sterile gloves of the right size, a sterile 10 ml syringe, a sachet of orhexidine 0.05 solution, an extra pack of sterile gauze, and a sachet of sterile KY gel. Lie the patient down in a comfortable position. Check the patient's vital signs and ensure that the patient is stable for tracheostomy tube change. Perform suction or cough assist to clear secretion. Aspirate suction above cuff port if using the suction above cuff tube. Wash your hands according to the 7 steps of hand hygiene. Clean the table with alcohol wipes. Open the dressing set on top of the clean table using the corners of the sterile dressing pack. Open the tracheostomy tube and syringe. Drop them gently onto the sterile field. Pour orhexidine solution onto the cotton balls. Squeeze sterile KY gel onto the sterile field. Put on sterile gloves. Do not touch the contents of the set until sterile gloves are worn. Squeeze out excess orhexidine solution from the cotton balls. If using a cuff tube, check the balloon by inflating it with 8 to 10 ml of air. Deflate the balloon fully. Milk the balloon to a cone shape while deflating. Skip this step if the patient is using a cuffless tube. Remove the inner cannula and place the obturator in the tube. This provides a smooth tip for insertion. Lubricate the tip with KY gel. The assistant will remove the old dressing. Remove the pillow and support the patient to lie flat. Keep the neck slightly extended. Release the tape with one hand supporting the tube. For cuff tube, deflate the cuff by aspirating all the air from the balloon. Disconnect the ventilator tube when both caregivers are ready for changing. With 2 fingers holding the skin open, the main caregiver removes the old tube with gauze in the same direction of removing the inner cannula. Cleanse the stoma site with pre-prepared cotton balls. Have a quick visual inspection of the stoma site for any granulation. Hold the new tube in the dominant hand with the thumb stabilizing the obturator. With the tip of the tube facing down, insert the new tube in a smooth curve motion. Holding the tube securely, remove the obturator immediately and insert the inner cannula. Inflate the balloon. Check the placement by feeling for exhaled air with your wrist. If you are unable to feel for any exhaled air, connect the ventilator tube to the new tube and observe for chest rise. If the chest is rising with air entry, the tube is in place. If there is bleeding, roll one piece of gauze into a long strap. Apply it around the tracheostomy tube. Cross the gauze straps at 12 o'clock position and apply dressing under flange. Secure the new tube with the tracheostomy tube holder. Continue to observe for chest rise, vital signs, and the color of the patient's skin. Keep a close eye on the patient for 4 to 6 hours after changing. More frequent secretion clearance might be needed for the next 24 hours. Blood stain secretion might also be present for the next 1 to 2 days. Please take note of these few situations. If high resistance is felt during insertion, do not force the tube in. If you fail to insert the tracheostomy tube in cases where the chest is not rising, decrease in SpO2 levels, or patient's lips and skin turn pale or blue, remove the tube. Cover the stoma hole and provide rescue breathing with a face mask. Call 995 for an ambulance. If the patient becomes unstable, where SpO2 levels are persistently below 90%, heart rate less than 50 or more than 100 beats per minute, low blood pressure, or the loss of consciousness, give rescue breathing and call 995 for an ambulance. Thank you for watching. For more information, contact HVRSS or speak to your doctor today.